Okay, hi everybody. I hope you can hear me well. We're going to start the next session, which is talking about small actions with big impact. And we have two stories from people who are out there making a difference. So we're excited to have on the line today here, Wren and Andy Tysoe. So we hear Wren is from the GMC, and she's going to share the pledge and story from the GMC to promote understanding of equality and diversity issues across patient, doctor, and student groups. And Andy Tysoe is a dementia nurse specialist at the Untitled Chapter hospital, and he'll be sharing with us his pledge about reaching 2,000 friends, dementia friends, by the 23rd of May, 2014. So we're going to ask both our speakers to speak for a few minutes, and then at the end we'll have a question and answer period. So get your questions ready and make sure you're contributing in the chat box and on Twitter. So I'm going to hand it over. Can I have the next slide, please? I'm going to hand it over to Jo. So Jo, I think you've got your camera on and you've unmuted yourself. So great. Thank you, Jo.
That's okay. Hi, everyone. Can you hear me?
Yeah, we can hear you well.
Perfect. Hello. Thank you. Thank you so much for inviting me. It's really exciting to be involved in this, and I've been enjoying all the stories that I've heard so far. So it's been really inspirational hearing about what everyone's been doing. So as I say, thank you very much for inviting me today. I'm going to talk a little bit about our team and sort of what our team has done, really, I think. I'm part of a team from the GMC called the Regional Liaison team. So if you could just pop the next slide on, that'll explain a little bit about who we are. We're quite a new team that the GMC has introduced. For those of you that don't know what we do, the GMC regulates doctors. So we're probably best known for striking doctors off and taking action against doctors if there are problems with their fitness to practice. But actually, another part of that work is spreading good practice and going out and talking to doctors about our ethical guidance and our ethical standards. And traditionally, we haven't really done so much of that side of the work. So that's where my team came in. I've been at the GMC for about 13.5 years, and I was lucky enough to be involved in piloting this team about 2 years ago. So as I say, there's 8 of us around England, and we've really been trying to work out how we can make a difference, how we can improve patient care, how we can help doctors feel supported in their role. So Change Day seemed like a perfect opportunity for us to be involved and to sort of help make a difference with the way the NHS was interacting with its patients. So we sort of got involved this year and encouraged the other people across the GMC to get involved. We had a blog about what we were doing that went up on our website. We tweeted ferociously throughout the day about some of the things that we were getting involved in. Some of the other pledges from my team included Howard, who's from the South East Coast, has become involved in his GP surgery patient group, so you can understand exactly the issues affecting general practice on the ground. Kelly Taylor, who's a doctor that's working with us, pledged to help junior doctors become more involved in making a difference, quality improvement activities. So she became involved in the Agents for Change conference that was held recently, that was helping junior doctors empower their leadership skills and helping them understand how they can become better leaders. And she got really involved in that from her sort of perspective. One of my colleagues, Tracy, pledged to help medical students understand ethical guidance better. So she contacted Peninsula and Bristol medical schools, who are kind of next to each other geographically, and was able to arrange a university challenge-style debate based around our ethical guidance with a couple of our other colleagues, and that went down really well. And there seemed to be some good fun in the room around some of the questions around, you know, what you would do if this were to happen and that were to happen. So that's just a flavour for some of the things that the team has done. Some of the bits and pieces in particular that I got involved in, if you could just put the next slide up. One of the main things that we were doing was looking around, with our ethical guidance. Traditionally, we publish a booklet and we send it out, and that's really sort of where our involvement ends. And we expect that our guidance is applicable to all situations. And actually, one of the things that my team has been hearing and that we've been understanding is that's not necessarily the case, and different people interact with healthcare in different ways, which sounds obvious when you say it, but I think it's not really been in our mindset before. So as an example, we were hearing things like, and I've had to scribble some notes, so forgive me for looking down, that from Indian patient experts, we were told that culturally they would never consider asking their doctor questions, even if they don't understand their treatments, which for us was really interesting, and that's something that we've been able to to highlight to doctors to make sure that if they're explaining something to an individual, to a patient, and they feel that that patient isn't understanding it, or perhaps they just want to double check something, think about some questions that they can ask that aren't just yes/no questions, but that are some sort of leading questions that the doctor can ask just to make sure that the patient has actually understood the issues that the doctor's been discussing with them. And we've been able to say to them, because we know from our research, from our engagement, that particular groups may find it difficult to question some of the things that you've been saying to them. So that's been really useful. Likewise, we were told that within Irish traveller communities, that healthcare workers can be surprised if they speak loudly, whereas to them that's a cultural norm and doesn't represent impoliteness. So again, we were able to feed that through to doctors, particularly doctors where there are large populations of traveller communities, and we've been able to sort of share that learning and that understanding, and that's helped ease the communication a little bit. Likewise, we've heard from some areas about there being lack of translators available. So when we've gone out and talked to doctors about quality improvement activities they can get engaged in, or audit activities, we've been able to suggest to them that perhaps they might want to look and see what translation services are available at the various surgeries or within the hospitals. Is there anything they can do to pull together resources? Have they got things in an easy read version for perhaps patients with learning disabilities, those types of things. So kind of taking the bits of information that we're hearing from patients and from certain groups, we're able to then feed that through into the teachings and the learnings that we're sort of sharing with doctors. Next slide, please. One of the other areas of work that we've been doing is encouraging doctors to just reflect on how their behaviour and how some of the things that they say, how some of the discussions they have impact on the patients that they're interacting with. Again, we had a gay patient come and talk to us as a group just to try and understand some of the issues that they perhaps face with accessing their healthcare. And one of the things that he told us was that he felt that he had to come out every time he saw a new doctor, because there was no sort of format within the notes for it to be kept that he was gay, but it meant that each time he was having to sort of have this intensely personal discussion, even if he was just going to talk about a problem with his knee or something on those lines. So again, we've taken that through into some of the bits and pieces that we've talked to doctors about around understanding how they introduce themselves, the types of questions that they're asking, the types of things that impact on the reason why the patient might be uncomfortable sharing information with them. We've worked with GLAD, the Gay and Lesbian Association of Doctors and Dentists, and the Lesbian and Gay Foundation this year as well, to try and understand, as I say, some of the concerns that patients face. And one of the things that we heard, for example, is that lesbians aren't routinely offered smears. So again, we've been able to take that through, and when we're talking to doctors, when we're talking about intimate examinations and chaperones, we're reinforcing that message to make sure that they're offering equal healthcare to everybody, and that they're not directly or indirectly discriminating. I think the issue here is that most doctors are doing an absolutely fantastic job, and I don't want to in any way suggest that they are doing anything other than that. But I think they don't have the time or the opportunity to be able to have the types of discussions that we're having with people. So they simply don't have the resource to be able to sort of find the nuggets of the information that we're able to do within our team, and that's where it's been really useful to share that. Likewise, when we go out and talk about our ethical guidance, we usually use kind of fictional case studies and ethical scenarios to help doctors understand how it applies in real life. So, if you're in this situation, what would you do? And looking at those scenarios in light of our recent sort of engagements, we've realised that actually they're not hugely culturally diverse scenarios. So again, we've been able to mix that up a little bit. We had one of our scenarios focused around a potential relationship with a lesbian couple. And when we ran that with a group of junior doctors, there were some rumblings of surprise around the room that we would feature a lesbian couple in it. And one of the junior doctors actually came up afterwards and thanked us and said that it was something that they'd never necessarily thought about previously. It wouldn't have occurred to them to consider some of the issues that came up as a result of that discussion. So it's been really interesting being able to do that. And likewise, we've been told some things in confidence. There was a student at a medical school who'd effectively been bullied after she'd come out and had received some very hurtful comments from fellow students, and she felt that the medical school hadn't handled it particularly well. And whilst she didn't want us particularly to do anything about it, she just wanted us to be aware that this was one of the issues that's going on. So again, when we're talking to medical students now, we make sure that we sort of include some advice for them on how they interact with their colleagues as well as with their patients, and how they need to be sensitive to the people around them, because we know that this can be a problem in some areas. So again, it's not suggesting that they're doing anything wrong, it's just reminding them that there are things that they need to think about. I have to say, I was also thrilled last week to be able to march in Pride in London, which was great. We went out with loads of colour balloons and got absolutely stoked, because obviously the heavens chose to open on the day that we were marching through London. But it was great to be out there for the GMC. It was absolutely fantastic to sort of be representing that side of the GMC's work, despite the dousing and dancing non-stop for about 4 hours down Oxford Street. It was great fun. Just a couple of the other things that we've been doing, if I could have the next slide, please. We have been doing quite a lot talking to doctors about how we work in our data, and again, this flows through us understanding more about what worries doctors. So we've gone out, and Tysoe, my colleague in the north in particular, has made great steps with this. This was her pledge really about working with equality and diversity groups, and while she's been working with equality and diversity groups with patients, she's also been doing the same with doctors. And there are a couple of groups out there that are quite large organisations that represent doctors from different backgrounds, and one of the things that we're very aware of is that certain groups of doctors are overrepresented within our fitness to practice procedure. So that means that certain groups of doctors from different backgrounds are more likely to receive complaints and are more likely to be investigated. So we've been going out and talking to these groups of doctors, explaining what we know, using the data from this report, the cover of which you can see on the screen, which tells us why we receive complaints. It tells us what people are complaining about. We've been able to use that and go out to these groups and say, you know, we know that this group of patients is more likely to complain to us. We know that they're more likely to complain about these types of issues, for example, communication. We know that there are problems with record keeping. So have you thought about that? So through kind of going out, finding these groups and hopefully trying to share our knowledge with them and share our understanding of some of the issues that they face, we're hopefully keeping them away from our fitness to practice procedures as much as possible, because obviously that's what we would like to know, that every doctor out there is practicing to the best of their abilities. Next slide, please. Oh, thank you so much. We love this slide. One of the things that I pledged in particular was to share good practice, because I think that coming from the General Medical Council, doctors don't necessarily enjoy interacting with us. I haven't necessarily understood that we can be supportive as well as doing the fitness to practice part of work. And I think when we started as a team, we were focusing on when things go wrong. So if something goes wrong, what do you do about it? You're presented with a situation where something's horrific. What do you do about it? And I think that through hearing about initiatives such as Change Day from last year, we were able to understand where there were pockets of good practice that would be useful to share around the country. So that was my pledge, was to try and find these really interesting examples of good practice that could be quite easily duplicated around the country. So some of the things that we've talked about are the Onion initiative at West Hertfordshire Hospital, where the new chief executive at the time came in and started these morning meetings where she gathers all the staff together and they peel back the layers of things that are going on in the hospital and across the trust, and the feedback from that has been fantastic. So we've been able to talk about that with other organisations, because it's something that doesn't cost much money to sort of pull together, but has shown some really great results. Likewise, we got permission from Dr. Kate Ranger to talk about her Hello, My Name Is initiative, which I'm sure many of you are aware of, and just really reminds doctors of the importance of a simple introduction before they go ahead and have the interaction with the patient that they're needing to have. So again, costs nothing, but something that we've been able to share around. Likewise, with medical students, we got permission to share the Ask One Question initiative, which has been sort of introduced over here mainly by a group of students in Wales that we've been talking to. And again, we're feeding that through to students. And the idea behind that is that medical students ask one question of a patient, which is, what can I do to improve your care today? And some of the feedback from what they've heard about that has just been fantastic. Things like a patient wants to go to sleep, but the sun was in their eyes and they couldn't reach the blinds, or they were thirsty and they couldn't reach the water, or they didn't understand what their doctors had said to them when they'd given them their new tablets. They hadn't understood exactly the details of how they were to take it, so could the student explain it to them? So again, fairly simple things that cost nothing, that help the patient feel better and also help the student feel better, because it made them feel that they were making a difference in the care that the patient was receiving. So that's been a really interesting one to be able to share around and talk to some of the medical schools and other medical students about that. Likewise with patient groups, I heard about One Health Watch, who have worked really closely with their local hospital, and they've been able to have a Health Watch person, so a patient representative, on the interview panels for the medics in the hospital, and they found that really interesting, and the hospital have found it really useful to understand how the doctors coming in react when they're interviewed by a patient and ask questions by a patient as well as by their colleagues. So again, that's something that we've been talking about as we go around the country. And finally, Change Day. We've been promoting change, the heck out of Change Day, I have to say. Whenever we're out and about, it's one of our fairly standard slides on things that you can do that are quick and easy and make small but quite noticeable differences to the care that people are receiving. We're encouraging people to come onto the website, read the change wall, read the pledges that are on there, and just understand how they can help, really. So that was all I had to say. There is a final slide that's got my details on if anyone's interested, and I'm happy to stick around for questions.
Great, thanks, Jo. Thanks very much for that. It's inspirational to hear how you guys are promoting Change Day and how you've used tackle some of the issues of diversity and the other things you mentioned. So we will keep adding questions to the end, and now we're going to move over to Andy. So Andy, if you can just unmute yourself, and I think your camera is on as well.
It's on?
Yeah, we can hear you. Andy?
Yeah, I'm here.
Okay, great. Go ahead. Yeah,
okay,
we can see you and hear you. Excellent.
That must be quite scary. Have you got my presentation?
Yep. We'll go to the next slide. Just let us know when you'd like to advance the slide.
Okay, thank you. That's brilliant. Thanks very much, Arthur. Hi, my name's Andy Tysoe. I'm a memory nurse, and I work here at the Countess of Chester Hospital. And thanks to a secondment opportunity inspired by Leslie at the West Cheshire CCG, I'm also a Dementia Friends facilitator working with Sandy and her team at the Cheshire West and Chester Council. Although, to be frank, I do prefer the word activist to facilitator, but hey, what can you do? I'm also a Dementia Friends champion for the Alzheimer's Society. I'm going to tell you the story of my pledge and the outcome of it. I've written it down and I'm reading it out mainly because it helps me to keep on track, and sometimes I can go on for weeks, so apologies for that. So I need to keep the time. So hopefully that'll be okay for you guys. My pledge for this year's Change Day was to create 2,000 Dementia Friends by the 23rd of May. That date was chosen because it coincides with the end of Dementia Awareness Week. But the journey began way before my current role was created. If I could have the next slide, please. Two members of the hospital management team, Sean and Leslie, had not only the passion to stand up for the rights of people with dementia, but also the courage to sit down and listen for when things basically went wrong. And we need to be honest in healthcare, we really do. On the back of a harrowing complaint received from a carer of somebody living with dementia, they decided to employ two dementia nurse specialists, and with the brief to work differently with people with dementia and to improve their journey through the minefield of an acute hospital stay. My colleague Sue and I started in the hospital in August 2012 in a role that evolved more or less as we went along, but it was driven by a local initiative, commissioning initiative, or CPRIN, from an old age psychiatrist called Nush, who worked at the local mental health trust, the Cheshire and Rural Partnerships NHS Trust. The role then also grew. It also grew to include the outcome measures from the National Dementia CPRIN, and also to design and deliver dementia awareness training for clinical staff. Now, I've always had the view that everybody who works at the hospital, from the front of house volunteer to the chief exec, should know the basics about dementia, what it is, and probably more importantly, what it isn't. When you think about it, 1 in 3 people over the age of 65 in the UK will die with dementia, and the average age of a patient in an acute hospital bed in the NHS is 75. A no-brainer for me. Oh, and here's another one for you. All staff, whatever they do for a living, are going to get old. They're going to have older people in their families and live in a community. So really, it's another no-brainer for me as well. I was also keen to offer these awareness sessions out to other organisations, members of the public, and carers of people with dementia too. Because when somebody, and I don't know if you agree with this or not, I don't know if I've used the right word, but when somebody gets given a diagnosis of dementia, somebody else usually gets given another diagnosis of carer. And then who equips that person for their journey ahead? Carers need education and training as well as ongoing support. Oh, and also we have access to the hospital's 100-seater lecture theatre, and we just wanted to fill the place up basically. And also, when you think about it, think about this. What is the point of a dementia-friendly hospital when the community it sits in isn't? The other thing I'd like to share with you, and it's all part of this whole thing around change for me, I'm never one to reinvent the wheel. So if there's something out there that you can, if you think of a change and you think of something that you want to do, check to see that somebody hasn't done it first. People can get quite precious about their material and their property. It's not worth it. You need to share that. So, about the same time as this, the Alzheimer's Society had just launched their Dementia Friends initiative. That was a social movement providing free information sessions on dementia and are telling people about the small things you can do to improve the lives of people living with dementia. It was also about creating dementia-friendly communities, so that seemed to be another perfect fit for me and another no-brainer. With some initial tweaking, the Chester model of Dementia Friends was born, providing a basic level of awareness and information on dementia for all, and also creating more dementia friends for the Alzheimer's Society. Another win-win. Over time, with suggestions and feedback, the sessions grew and evolved to include more information on dementia and the priceless stories and experiences shared by participants. I'll tell a story of Bert's wife and an anniversary card, and also a guy who went round a supermarket with his wife, and the concern just buying tomato sauce brought him. But then you'd need to see the session to understand those stories. And I usually start the session by encouraging people to think a little bit differently about dementia, and also share a vision that I'd like to see of a dementia-friendly checkout till in a supermarket. Why not? And when you think about all the reasons why not, probably they're the reasons why you should. I then finished the session with a very moving poem, which I'm happy to actually share with you at the end of this story. It was sent in by email from a participant who thought it would be a good way to end the dementia session. And it's probably a good way to end my session here as well. Word started to spread about these sessions, and requests were also made to run them outside the hospital boundaries, in community halls, GP practices, shops, banks, and other publicly accessible buildings. Listen though, this isn't just about me. It can't be. Have the next slide, please. Thank you. That was freaky. It's also about the people who enabled and inspired me to make this happen. The fantastic people and organisations I've already mentioned, and other forward-thinking movers and shakers within them, learning from when things go right as well as they go wrong. And here's the model of change. It's a multiple choice. You can, A, sit safely in your trench. You can B, peer over the parapet, or C, you can just leg it across no man's land and be brave. I brought in a picture of my cat Gatsby for you to have a look at, and that's how he did it. So I hope you can all see that. I'll show that later if you need it. But that's Gatsby sat in a wall. It's just a lovely picture. Anyway, don't forget, if you're gonna implement some change, you need to take people with you and look around for weapons too. There's all sorts. There's carrots and sticks. You can use legislation, national guidance, regulation from the CQC, and even the success of others. There's also the Mental Capacity Act and the Human Rights Act. I've legged it across no man's land with all kinds of people, all the ones I've already mentioned and others collected on the way. For example, Mel, Midnight Mel, our general nurse who has joined the dementia team, and an early supporter, Steve, who's the ward manager on Ward 34 at the counter, who generously, very generously, supplied the props for this slide before I actually thought about using them. Freaky. Anyway, oh yeah, and be prepared to take income, because it's not just and not just on the front too. Sometimes you do get shot in the back. So the more people you inspire to let it across with you, the bigger the target, which is fantastic, for me anyway. But really, it's all fine and dandy being out on point. But it's the people who take the risk and come with you that provide the sustainability and also to watch your back as well. If you do make it across no man's land, share your success with others and don't be pressured about your intellectual property. Think of the greater good. Sometimes you don't know where all this is going. You don't know where you're going to end up, but you know you don't want to be where you are. So that could even be a motivation for change on its own. Be innovative, passionate and positive, and don't stop until you get arrested. Rock the boat, but remember, the bigger the boat, the more people you'll need to rock it. About the next slide, please. The impact of the 2,000 plus people who have now attended these sessions has been widespread. Incidentally, my colleague Sue has also just hit the 500 mark, so we're really trending up in Cheshire West. The impact has been quite widespread, from a desire to create a dementia-friendly council borough from the leader of the West Cheshire Council to simply changing the colour of a pot of paint from one of the decorators who works here at the hospital. After attending a session, our chief exec, Tony, described it as a game changer for him. And Asha, an obs and gynae consultant, said, as doctors, we think we understand most diseases, but that's a myth. You explained dementia very clearly. I am now very motivated to help these people. And people from all walks of life, health and social care staff, yeah, banks, businesses, museums, schools, and even the armed forces have attended, and including an architect. All have pledged to do something different to improve the lives of people who live with dementia and their carers, including staff from Tesco's, who promised to deliver on my dementia-friendly checkout bill. People have also been inspired to become Dementia Friends champions, and we've recently hosted a Dementia Friends Champions Facilitation Day here, thanks to John down in Malthus, and we've got another 20-odd Dementia Friends champions to start rolling out the story as well. We've also, in the hospital, created our own dementia operational group, and we've just launched also the West Cheshire Dementia Action Alliance. Our second dementia-friendly community, Blacon, which is an urban area of Chester, is launching this afternoon, so I'm off there in a bit. I'm also now working with NHS Strategic Clinical Networks, and I'm chairing a task and finish group on my other Change Day pledge, which was to see the Chester model of Dementia Friends, with all it entails, the whole package, rolled out across other NHS hospitals if they want it. So basically, and this is only just really coming to play. Basically, what the Chester model does is it meets the outcome criteria for Tier 1 of Health Education Southwest Basic Dementia Awareness Training, which there is now a mandate for that to be all across the NHS. Unfortunately, the Alzheimer's Society's Dementia Friends session as it stands doesn't, so we need to marry those two up. And I think I've found a way to do that. The Chester model of the Dementia Friends meets that requirement of Tier 1. The Alzheimer's Society are also happy to support the rollout of that and have endorsed the enhanced version. And we'll also be putting on a Champions Training Day for me so I can attract other people from different hospitals to go on a Dementia Friends Champions course, learn how to be a facilitator of that, and then come to spend a day with me at the counter and then learn about the Chester model. And again, it's all optional. You can't force people to do this. So, what are we looking at now? Are we looking at the opportunity to create a dementia-friendly NHS? Have the next slide, please. So, when you're in a position to work in true partnership within all these different organisations, you can start to see the many shades of grey that surround the black and white of each one of them, and how you can then start to join things up and make sense of a bigger picture. I've found solutions are easier to see. Not all the time, but sometimes easier to resolve too, because you've got the benefit of the insider knowledge of that culture and the personalities of those differing bodies working alongside the people that you need to talk to instead of bland emails. You've also got the advantage of making things happen by knowing the right people to link up with each other as well and network. Yeah, and I think I need another vision to start my awareness sessions. Next slide, please. Hey, get it. In May this year, probably the first ever dementia-friendly checkout till was officially opened by the Lord Mayor of Chester in a Tesco supermarket. It was a symbolic event. The council and commissioners provided the signs and the time. the Countess provided the awareness session for the Tesco staff, and the local and regional Alzheimer's Society provided the press person and the leaflets and information too. That is true partnership working for the community and for the greater good. For my next vision then, so I've got to think about something else. How about this? How about making the forget-me-not symbol for Dementia Friends as commonplace and as synonymous and alongside the blue disability badge? That would actually really change the way we think about people living with dementia in the UK, and also change the way society and community views those people living with dementia. Next slide. So it's great to get some publicity and get some profile. That's all great and good, but it's not the end of it, because it's all about the cause. And then why not celebrate your cause? Don't forget, that's all part of it as well. It makes people feel good, and it also draws a line and demonstrates that you've actually achieved something too. This picture here, that's the official launch of the West Cheshire Dementia Action Alliance last month. 120 people from around the borough came together to pledge to do things differently and to put it all on the map. They're leaders of all the some of the leaders of all the organisations that I've already mentioned, some representation, and also members of the public too. We put on a Dementia Friends session there, and the leader of the council became the 2002nd person to become a Dementia Friend, so fair play, and he made a very poignant pledge as well. We put on a marketplace where other people could come and demonstrate what they've been doing and sharing. We had a lot of networking. We also had the aspirations of national, regional and local speakers. This is key now. This is key and something I haven't mentioned just yet, but this has been all the way with us all the way through. We've also listened to people who have got dementia. And at the conference, we listened to somebody who was living with vascular dementia and his carer, who were brave enough to get up in front of us all and share their view of what dementia-friendly communities should look like. Real stories, real people, and very powerful. Okay, the final slide. Thank you. A couple of nights ago, this is the thing. When you pledge something, really, sometimes you don't know where it's going to end up, where it's going to go. But I'll tell you where I ended up a couple of nights ago. I ended up delivering a session of Dementia Friends for nearly 50 people from inside the Chester Cathedral, right in the heart of the city and right in the heart of the community. How fantastic was that? That was an amazing, amazing experience. And it was something that just fell in together by people talking to other people and, oh yeah, he'll do this, and somebody will bring along the pull-ups, and it was a really fantastic time. And thank you to the Chester Cathedral guys who actually helped facilitate that and put on all the great teas and coffees. It was really good. Ranks right up there with the experiences for me. I've also been asked to be the National NHS Change Day hubby for dementia. And again, I've got no idea what that will look like at the moment. A bit dodgy, guys, sorry. I don't even know where it's going to end up. What I do know is that I will need support from others from around the country, and also the inspiration and enabling power of NHS Change Day too. Okay, right. I mentioned a poem earlier, so here it goes. This is the poem that I end my sessions with. It's called The Alzheimer's Poem. It's by Owen Darnell. Do not ask me to remember. Do not try to make me understand. Let me kiss and know you're with me. Kiss my cheek and hold my hand. I'm confused beyond your concept. I am sad, I'm sick, and I'm lost. And all I know is that I need you to be with me at all costs. Do not lose your patience with me. Do not scold or curse or cry. I can't help the way I'm acting. I can't be different, though I try. But just remember that I need you, that the best of me is gone. And please don't fail to stand beside me. Love me until my life is gone. Thank you for this opportunity. Listen, guys, keep rocking the boat. You need to keep rocking the boat. Don't fall out. Don't fall out. One last thing. I've made another pledge, and I've got another change day coming up on Monday. I'm getting married to Jill, who I love, +++, in Lisbon for quite a week, really. Thank you all. Cheers. That's me done.
Thanks very much, Andy, for your inspirational story, and I love the poem at the end. Amazing. So I just want to open this up now to anyone who might have any questions on the line for both Andy and Joe. If you can just raise your hand, and you see the little, hopefully you'll see the little hand button at the top or on the middle of your screen on the right-hand side. If you raise your hand, we'll just unmute you. And in the meantime, when you're thinking about the questions, I'm going to go to Pip and to Rosanna to get an update from Pip about what's happening on Twitter, and then an update from Rosanna afterwards about what's happening on the chat box.
Hi, Nina. Thank you.
Hi.
It's been really interesting watching Twitter and listening to the last few speakers. So for those of you who can see Twitter, I've actually made a little Wordle, which I thought might encapsulate some of the themes from this morning. And the words that seem to be coming up again and again and again are celebration, inspiration, connecting and connection, obviously change and innovation, improvement. It was fascinating hearing Joe's talk about diversity and equality and the different ways the GMC is promoting that, and I think people really appreciated that. And Andy has clearly touched lots of people's hearts, and there are several tweets about how wonderful it is to hear about the Dementia Friends project. So I've also noticed that the number of people attending the WebEx is just steadily climbing. So that's a really lovely thing to see, and more tweets are definitely coming through. So it's looking good for the rest of the day.
Great, thanks, Pip. And Rosanna, are you there?
Hi, yes. Lots of comments feeling very inspired by Andy's talk on the web chat. And, you know, a couple of quotes from there: dementia is everyone's business. And Linda McKench, new CEO, has become a dementia champion. She wants to share that with us, so that's
Brilliant.
fantastic. I think there's a bit of a theme that has been emerging throughout the day, and Charlie Keeney adds to that again, which is about the importance of, you know, widening the influence of, you know, non-change type groups, so voluntary and other groups in, you know, in sort of widening the impact of this community, of the change community, and the influence that NHS Change Day has on that. And Damien, again, talked a bit about how it's great to use Change Day to share great ideas. And just finally, there's a request also for the Twitter handle for all the speakers, so I'm sure we can get that out onto the web chat at some point today.
Great, thanks, Rosanna. I have a question for both for Andy and Joe. I guess, Joe, if I start off with you, just reflecting on what Andy has said, I wonder if there's, and your comments about looking at diversity and some of the other issues that the GMC is looking at. Has the GMC done any pledges around dementia?
We haven't, but I was scribbling ferociously as I was listening to his talk, which I thought was absolutely fantastic, and I've taken down all his details to pass on to my colleague who's from that part of the country, because I think there's some really interesting points that came out of some of the work that he was saying, and I loved the analogy of the more people you inspire to leg it across, the bigger the target. I think that's such a wonderful way of trying to encourage people to come along with you. So it's not something that my team in particular has done much on at the moment, but I definitely think there's scope to do work there in the future.
Excellent. And Andy, what's your recommendation to Joe and the GMC about how they can get involved in some of the work that you've been doing?
If you're a doctor, if you're going to get old, if you're part of the community, you need to be involved. So absolutely, there's loads and loads of research around. There's all sorts of different bodies that are doing that. What else have we got? We've got the Dementia UK who are doing huge amounts of resources. Even if it's something like just going on the House of Memories, Liverpool Museum's website, and downloading their new app, it's absolutely fantastic. Just to sit there with that app, it's free, and then you can just sit and engage with somebody with dementia, because that's what you need to do as well. So there's all sorts of things you can do. You can take a virtual dementia tour. That's something that we've had at the hospital, and many people, I've just been talking to Sue, one of our directors here, about that, and the impact that's still having on her. That's something that you can do. So that there is loads of things to do more.
Okay, great. Okay, so can everyone, thank you very much, Andy and Joe. And everyone give them a virtual round of applause, and you'll see that again on the little, there's a little bubble with a check mark. And if you go click on that bubble, you'll see a little option there to applause. So I just click that. You guys can do that too, that would be great. And we're going to move on to our next session. So thanks, keep the chat going, and if you guys have any questions for Andy and Joe as the day progresses, just put them in the chat box or put them on Twitter, and we'll send them out to them. Okay, great. Can I have the next slide, please?